Good morning. Thank you for the invitation in this wonderful table. My talk is Dupuytren ultrasound-guided aponeurotomy. As you know, there are many surgical options for Dupuytren disease. I am going to talk about a mini-invasive technique, the ultrasound-guided aponeurotomy. Dupuytren is a lifetime disease. The skin is our most precious value, and especially if you treat a young patient, you will have a problem with the skin scar, especially if you have a recurrence. Indications for ultrasound-guided aponeurotomy are Tubiana stage 1 to 3, affecting 1 to 3 rays, even with PIP joint contracture. We have a video technique in the American Academy of Orthopedic Surgeons with my partners of Avanfi, Dr. Villanueva and Dr. Iborra, and we have published our technique and the results in the Journal of Hand Surgery last year. Advantages of this technique are patient satisfaction. You can perform the technique in your private office. The quick recovery after the procedure is easy to repeat at any time, easy, precise, and safe technique, especially and even if you have a PIP joint contracture. One of the things that the patient likes more is that an office procedure. And what do we need for this surgery? We need a local anesthesia with Wallant, a needle of 18, 21, and 22 Gs, and a probe linear transducer between 10 to 17 MHz. First, we palpate the cord and we identify the cord with a probe. Then we select our entry points from proximal to distal and ulnar to radial, and then we introduce the needle and we use it as a scalpel. Here we can see Dupuytren stage 2. Here we can see very nicely the needle punching the cord. And here we can see how we do this technique in our office, doing multiple perforations from ulnar to radial and deep to superficial until the cord is released, as you can see here. We do multiple perforations and then we break the cord and we can extend the finger. Here is the result of this patient. And one thing that is amazing for the patient is to see how the patients can extend and make a fist just after the procedure. This is another patient with a Dupuytren disease. The result after the procedure, and 6 days after the surgery, we can see the patient moving very nicely the fingers with the entry portals that you can see here in the hand. Also, we can do this procedure in PIP joint contracture. Here, the problem are the neurovascular bundles because they are very close to the volar plate. So we must check with the Doppler where are the neurovascular bundles, insert the needle just below the flexor tendons, and do the release of the volar plate and also the accessorial ligament. Here we can see a case with a cord of the forefinger and a PIP joint contracture, and we can see the result just after the procedure with the movement of the hand. Really important when you have a severe joint contracture is the need of a splint and the help of a hand therapist. So we can conclude that ultrasound-guided aponeurotomy is a safe, reliable, and mini-invasive technique for the treatment of Dupuytren disease and less invasive than open procedures. Thank you very much for your attention.